5 points about why is jackfruit good for diabetes. A review by nutrition professionals. Low glycemic index. Jackfruit has a low glycemic index, meaning it causes a slower rise in blood sugar levels compared to high glycemic foods. This quality makes it suitable for diabetes management as it helps in better blood sugar control. Rich in fiber. Jackfruit is high in dietary fiber, which aids in slowing down the absorption of sugar into the bloodstream. This can prevent spikes in blood glucose levels after meals, promoting more stable blood sugar levels. Nutrient density. Jackfruit is packed with essential nutrients like vitamins A, C, and B complex vitamins, as well as minerals like potassium and magnesium. These nutrients play a role in overall health and can support individuals with diabetes in managing their condition. Natural sweetness. Despite its sweet taste, the sugars in jackfruit are primarily natural sugars, which have a milder impact on blood sugar levels compared to refined sugars found in processed foods. This makes jackfruit a suitable alternative to other sweet snacks for individuals with diabetes. Potential insulin sensitivity. Some studies suggest that certain compounds in jackfruit may improve insulin sensitivity, which is beneficial for individuals with diabetes. Improved insulin sensitivity can help cells in the body respond more effectively to insulin, the hormone responsible for regulating blood sugar levels. However, further research is needed to fully understand the extent of this effect.